Hello, I want to welcome you once again to this channel. I must appreciate you guys. To all my subscribers, all my viewers, I want to thank all of you for joining me and subscribing to this channel. I want to appreciate all of you that have been sharing my videos to different platforms, and you guys are amazing. I must appreciate you guys for helping out to reach into the public through this channel to understand some important health issues and importance of exercising and other pressing issues within the environment. My name remains Chidebereze and I'm a medical doctor. Today's topic we are talking about why some men die during sexual intercourse. What is the cause? What are the possible causes or risk factors of this disorder or ailment, as we may call it? Why will men die? Why will a man die when he's having sex? Why? What is the cause of that? Please, I want to plead with you, if you have not subscribed to this channel and you have seen this video, kindly do the needful. Just subscribe. Hit the subscribe button as you've seen it now. Hit it and turn on the notifications. So anytime I'm going to place any video on this channel, you're one of those that are going to get it, and share my video with your people so they will understand some of these things I'm discussing on this channel. So I want to appreciate you as we go on to discussing this. Now, before we talk about why will a man die during sexual intercourse, we have to understand the normal. What is the normal thing that happens during sex? There is release of hormones, especially the testosterone, which is a happy hormone, and other happy hormones also that are released into the system. But essentially, the primary hormone for sex is testosterone, and it causes erection. Now, what happens is that there is activation of the parasympathetic nervous system. The parasympathetic nervous system, as you are seeing on the screen, sends the signal to the male external genitalia. I have discussed about male external genitalia. On the description button, you are going to see the video concerning the male external genitalia, the component of male external genitalia. But what happens is that there is a release and push of blood because there is a vasodilatation in the corporal bodies. There is the corpus spongiosum and the corpus cavernosum. There is release of blood, and because of that vasodilatation happening there, that blood retains and there will be erection. So that is the work of the parasympathetic nervous system. Following erection, the sex itself starts. Sexual activity now begins. Man begin to have sex. The man or woman begin to have sex. So that sex continues to the point that man gets to ejaculation. Now, ejaculation is carried out by the sympathetic nervous system. And what does the sympathetic nervous system have? It has it contains the adrenaline component. That is the hormonal part of it, the adrenaline, and it causes the vasoconstriction. Then the vasoconstriction is not going to be limited to the penile region. No, it's going to involve other parts of the body as well, including the heart, and the brain as well. So that vasoconstriction with increase elevation of blood pressure and serious contraction of the heart. Let's say a heart that was beating at the rate of 70 during ejaculation, it will be beating at the rate of 80, 90, and 100, and the BP of let me say 120 may get to the point of 140. Do you understand? And a man that has background hypertension, maybe of 200, may get to 220 or 240, as the case may be. That is what happens in normal sexual intercourse. Now, talking about why will a man die, or why will most men die, or some men rather die during sexual intercourse, you now begin to appreciate who are at risk of death during sexual intercourse. Now, age is a factor itself. Age is standing as a non-modifiable risk factor of death during sexual intercourse. So now, what are the age I'm talking about? Advancement in age. So people that have died much during sexual intercourse are those that are elderly and middle age. Now you have to understand what I mean by that. Middle age are age between 45 years to less than 65. That is 64. And elderly age is from 65 years and above. They are the elderly. And people that die more during sexual intercourse are those people that are within this age range, with more happening in the elderly. This is one of the risk factors of that. Also, people that have background chronic diseases, for instance hypertension, just as I mentioned, you begin to appreciate what I mean. Now, if a man has BP of 200 or 180 before commencing sexual activity, During sex itself, with the release of that hormone adrenaline, that's during ejaculation, that is the point when most men usually die. You see that the PP can go up, maybe from 200 to 220 or 240, and that man may die from there. This is one of the risk, another risk factor, apart from age, hypertension, background hypertension. Also, people that have background heart diseases, for instance, myocardial infarction. There are some men that have it, and you may not know. So now, how will you know that you have background heart disease as a man? It's just by background heart disease, for instance, myocardial infarction. It's by going to the hospital, meeting your doctor, doing a test that's called ECG, and that may be a salvation point for you. Also, people that have coronary heart disease, maybe because the blood vessel to the heart is not well open during sex. Now, because of that massive and increase in activity, because the heart begins to contract and beat more than normal during ejaculation. So blood may not get to the point of to the point where you have beyond the point where you have that coronary heart disease, and the person, that part of the heart may not contract very well. The person may die from it. These are some of the risk factors of death during sexual intercourse. Also, men that take illicit drug, that involve in illicit drug enhancement, people that want to kill during sexual intercourse, they will say harder. Because of that, they may die. Drug enhancement, sexual drug enhancement. And also people that take illicit drug like cocaine. Cocaine itself is a drug that increases or activates the sympathetic nervous system. Now, adding the effect of cocaine to the effect of ejaculation, that is massive release of adrenaline during ejaculation, you can begin to appreciate what happened. Now, assuming that man that took cocaine has background heart disease or has background hypertension, you can begin to appreciate what may happen to such a person. So these are some of the risk factors. Also, those people that have berry aneurysm, who may have berry aneurysm, don't know, because berry aneurysm happens in the brain, and there is dilation of blood vessel. That part of blood vessel is ballooned out. Then during sexual activity, that part of blood vessel that are ballooned out in the brain may rupture. So that rupturing can result in subarachnoid hemorrhage, which is a form of stroke. So some men can have stroke during sex, and we need to ask, why do a man have stroke during sex, and they need to blame the woman? You shouldn't blame the woman. The man might have had background risk factors for stroke, and nobody may know about it. A man may die or have developed stroke from it, and they need to blame the woman. So these are some of the risk factors. Also, something that is also controversial. This one is quite controversial. Some of us may disagree with it, but it is documented that people that engage in extramarital sex is a risk factor and possible cause of death during sexual intercourse. Then one of the reasons that this may be this may contribute rather, is because of the way they may engage in the sex. Maybe the environment, they may be afraid of going to a good place, maybe drug as well, maybe drink, and a lot of things. So these are some of the things. And then the thought of being caught may also be there, and that can elevate blood pressure. A man that normally had a blood pressure, then started trying to be afraid or run away from somebody. From there, he may develop a cardiac arrest, and you see death coming. So these are just some of the risk factors and some of the reasons why men die during sexual intercourse. Now, what can we do about it? What can we do about some of these things? One thing is to know problem. Another thing is to offer solution to it. So now, one thing is to be educated, just as I'm doing now, trying to educate the general public so that you understand why. So if you are advancing in age, you need to understand that engaging in marathon sex may predispose you to death. You understand? So you need to avoid some of the advanced sexual activity, because life has no duplicate. Do you understand? Now, if you have background heart disease, you should be treated. Go to your hospital, meet your doctor, and your doctor will treat you. If you also have hypertension, you begin to engage your doctors and then do some of the things that I'm teaching on this channel. Now, I am going to place also a link or some of the physical activity you should do if you have hypertension. For instance, you're a man, you have a hypertension. engage in aerobic exercise. So I'm going to place a link. Just go to the description button. You're going to see some of the videos that you may watch that may also help you to reduce hypertension, because aerobic exercise is one of the ways of treating hypertension. So if a man, a guy, you're watching this, you have hypertension, just engage in some of these things I'm going to do. I want to talk about exercising and of course your dieting. You understand? So these are some of the things. Then also extramarital sex. I don't know how I'm going to talk about it, but you should know what to do to yourself. Do it and help yourself. So I want to appreciate everybody for listening today, and then I wish you can help me to share this video so that most people that don't know about this may know about it. And then like my video, drop your comment as well. If you have any question, drop your question. Feel free to chat me up at any point in time on this channel. Drop your question. I will help you concerning anything that is troubling you medically. I appreciate you guys. Thank you so much as we go on.